But I think that today we are not talking about me, but we will listen the emergency, how emergency number is working in Sweden, and we also will listen Malaysian experience. So with me here are Björn Skoglund from Sweden and from SOS Alarm, and Azhar Sulaiman from Malaysia. So first speaker is Björn. Floor is yours.
Thank you, Kaili. I think I will stand up and talk. Okay, nice to meet you. I've done this before a couple of years ago, and things are happening, of course, in the surrounding world. So we are the good things and maybe not so good things. And I will lead you through this. I'll start with some quick facts about Sweden. We're quite a large country when it comes to the area, but quite a small country when it comes to the population. We are a long country, as you see. It's up in the far north. We don't have polar bears, but it's over the polar circle. So we do have lots of snow still in Sweden, in the north of Sweden. And most of the people are in large cities, or in cities anyway. So 85% is in cities and the rest is in the rural environments. We do have mountains, we do have archipelagos, we have lots of lakes, so we have some challenges. What we do not have is volcano eruptions and things like that, so we are quite happy anyway. SOS Alarm, yeah, we are a company actually who are owned by the Swedish state, the municipalities and the regions. We were introduced in 1973, we started the first PSAP in 1974, so I would say we have a long experience of doing this. And we are working on an agreement with the Swedish state, who are, of course, responsible for the 112 number. What we do? Yeah, we do answer calls. I will go into detail later, but we do answer calls on the 112 number. We handle the interview for fire rescue services and most of the emergency medical services, not all. And we do this also by agreements. We do work on agreements all the time. We also handle dispatch for most of the fire rescue services still, but there's a change coming on that, and most of the emergency medical services. For this, we have around 900 PSAP operators, and that's both call takers and dispatchers, and some team leaders actually also. We, as I said, we have a long tradition of a single emergency number. We started introducing this in 1956, and then it was the number 90,000, 90000, that was introduced. It was fully introduced in the beginning of the 60s, so we do believe we were the first, we have the first national emergency number fully introduced. I know that UK were the first to introduce a single number, but I think we were the first to fully national introduce it. The situation around 1970 was that there were a lot of PSAPs, and this was a situation that was not good. And then there was a governmental investigation in the beginning of late 60s, beginning of 70s. And that's why we do exist in SOS Alarm. We introduced the 112 number in 1996. We were among the last to introduce it, actually. We did in 2009. We did our CAD system was connected in a network, so we can answer 112 call in the south of Sweden, in the north of Sweden, and vice versa. We have had two investigations, governmental investigations on the 112 system, and they concluded that it's all right as it is today, so we don't have to do anything. We have mixed feelings about this. We are proud that they think we are doing a good job, but on the other hand, there are some lacks that we think we are talking about the unbroken alarm chain. You call 112 and you talk to one call taker all the time who does the interview. That's the ideal for us, but it started to be fragmented. I will go into this soon. We started with national reception in 2013 of 112, and we are right now developing and going into next generation 112. This is a work probably, hopefully, we will be ready in 2025. We'll see. These are the resources that you can reach when you call 112. Police, fire brigade, of course, ambulance, air rescue, sea rescue, mountain rescue, of course, since we have mountains, Coast Guard, but we also have priests on duty, not 24/7, but in the nighttime. We have tip-on smuggling to the customs. We have poison control and social welfare services through 112 number. But we also, in connection with 112, we do lots of crisis preparedness missions. And I mean, this is actually quite natural because 112, when a crisis erupts, it almost always goes through the 112 number. So we do surveillance around monitoring things that happen, and if we see that this should be, we should alert an authority. We can do this we have a special crisis preparedness unit who does this. So they can actually start the authorities working with the crisis in an early stage, as early as possible. We also have public warning, the VMA, as we call it, public warning system. We do handle this. We are the contact point for it. And we do have an information number for information on serious crises, serious accidents and crises. And this is to unload the 112 number. And it works real fine. And we do notice during the pandemic that this was a success story. If we didn't have that number, we would have been overrun on the 112 number and the health information number. I've struggled to find the right EENA model to well, tell you how we do this, how to describe how we do it. I will have some variations on this. I will go to them soon. But we do answer all 112 calls, and we do handling the interview for all fire rescue services, I said, and most of the emergency medical service. We do dispatching for most of them. The police, we are forwarding calls to them, and they do the rest. And I say we are working on agreements, so there's very scarce regulation on 112. We do agreements with all concerned. And as I said, I told you about the governmental investigation. So, and we think that there's a risk that the unified system is breaking up. As I said, the police, when we are established that this 112 call is only a police matter, we do forward the call to the police. They handle the interview, they do the dispatch. We do not know what they are doing on their side. The cons of this are, of course, that the caller has to repeat everything again. When we answer, they tell us what has happened. We forward to the police, and they will start telling the same thing again. So it's not a good. It's a waste of time, really. And we haven't had the possibility to transfer data between our systems. We have two quite different systems, SOS Alarm and the police. But we have a pilot ongoing now. So from this autumn, we think that we can start transferring data to them and also getting some data back from the police. Are they going? Are they not going? And so on. When it comes to emergency medical services, this is when it gets quite hard to describe. We are doing the triage part and dispatching of ambulances for 18 out of 21 regions. But as you can see, we have three different models. One where we do all the interview. It might be the call taker who performs all the interview. We have registered nurses who can help the call taker if needed, take over the call, and we do the dispatch. Some regions have a mixed model where they do the interview and we do the dispatch, and some regions do it all themselves, interview and dispatch. So if we notice that this is a call concerning just emergency medical services and it's in one of three regions, we forward the call. And also there we transfer the location data and the phone number, but not anything else to these regions. And historically, if we go back to the beginning, we did perform all the interview and dispatching for all regions, but some of them think that they would do it better, so they started their own PSAPs in 2011. One of them came back later and saw that the grass wasn't greener on the other side. And approximately 1 out of 5 calls are actually, after interview triage, is deemed not to be in need of ambulance. So we are referring them to go to hospital themselves or stay at home or take a taxi or so on. And when it comes to the fire rescue services, historically, also there we have done interview and dispatching for most, except 1 or 2, I think, from the beginning. Since then, there was a large fire in a nightclub in 1998 in Gothenburg. I think there was around 65 casualties, young people who died in this fire. And there was a lot of calls to the 112 number, and we just forwarded them to the fire rescue services, which they were overwhelmed. They couldn't handle this. So there were misunderstandings and so on. So there was an investigation who said that SOS Alarm must do the interview. So since then, we are always doing the interview. But there's a trend when it comes to dispatching. We are doing it mostly for the most fire rescue services, but as we speak, there's a transformation where they are clustering in the own PSAP stage 2 centers. I will show this not in the next picture, but in a few pictures. This is our strength, I think. We have joint cooperation when it is a call, let's say a road traffic accident. That will, of course, involve both fire rescue services, emergency medical services, and the police. We do the interview and we do a listening in. We are connecting, so the dispatcher at the fire rescue service and the ambulance service, and most of the time also the police can hear what's happening and going on and can take action before the call is ended. And these are about 10% of the cases. And I try to describe it in this model. The emergency call comes in. We have a call taker at SOS Alarm who performs the interview. And in the perfect world, within 24 seconds, he or she, the call taker, has seen that this is a call that needs both police, fire brigade, and ambulance. And they perform this listening in, so the dispatchers can listen to it. They can start alerting the fire rescue, ambulances, and so on. And we do the interview, we give advice, and if needed, we have the registered nurse to give advanced medical advice. This is a trusted model. We have done this since the 70s, so it's basically the same since the 70s. And still working really good. When we perform the call taking, as I said, we have a network with all PSAPs, SOS Alarm PSAPs in the same system called Telekom. This system gives us a flexibility, and we do have 3 models where we usually do the local login. All the 15 PSAPs log in and handle calls in their own region. Dispatch is always done locally, no matter which model we use. We have a regional collaboration where some SOS centers, PSAPs, works together. We have a threshold where calls from the larger PSAPs can flow over to other PSAPs. And this is used, and the local login we use for Stockholm, Gothenburg, and Malmö, the large cities. They have to, at the great extent as possible, handle their own 112 calls. But as I said, if they're too much, it's an overflow. And we do have the national reception where calls are flowing free. So it doesn't matter if you are in Malmö, you can answer a call in the northern Sweden, in Luleå. And these models are giving us flexibility and a very good, we can use them momentarily. So we have a national production management who can momentarily tell all call takers that now we log into the national reception, for example. As I said, we have 15 PSAPs around Sweden from the north to the south. We did have as many as 20 PSAPs, but in 2013, the trend was starting that we should reduce. This was after the first governmental review, where we saw a need to reduce the number of PSAPs. So we did it, and we went down to 12 PSAPs. But since then, we actually reopened some of them. Why did we do this? Well, we see that it's there are certain pros, as you can see. We are less vulnerable. It's good to be locally anchored, so to say. We do get better contingency if there's a PSAP knocked out for some reason by COVID or a fire or whatever. We have 14 other PSAPs that can handle the calls and do the dispatch also. We have redundancy. It's easier to hire staff in a smaller city than it is in Stockholm. And the local and regional presence is, in fact, quite important. The cons, of course, I mean, there's larger costs. The more premises you have, the more facilities you have. And they are scattered over a wide area. I mean, it's like 1,500 kilometers from north to the south. We have a national operational coordination, as I said, a management 24/7, and we do have team leaders on every PSAP. And I think this is quite important. You need to have a local management of some kind 24/7. You need to have it in place, actually, to lead the operation. And as I said, we do have a specialized crisis preparedness PSAP who works 24/7 with monitoring Swedish interests within Sweden and abroad also, and giving notice to authorities if something happens. Yeah, you can read for yourself. Then we do have 15 PSAPs. Not all of them do everything. We do the interview for fire rescue services, but not the dispatch. And I'm not sure about these numbers. We do dispatch, I think, in 8 PSAPs today, and the fire rescue service has 10. But this could have changed since I made this PowerPoint 2 weeks ago. So it's an ongoing process now. What's interesting is we are interconnected with each other in the SOS Alarm PSAPs, but also with all fire rescue services PSAPs. And this is good for exchanging information. This can be done very easy. It's harder to transfer transmission to the emergency medical coordination centers, as I said. We do some, as you can see here, but it's mostly the phone number and the location. We do share data also with the Joint Rescue Coordination Center, CNR Rescue. And as I said, we intend to do it with the police probably from this autumn, hopefully from this autumn. I think that will reduce the handling time for both us and the police. We do have key performance indicators, and this is in our agreements with the state or with the municipality or with the regions. So annually we are reporting to the states the average answering time, and that should be under 8 seconds. But also 92% of all calls should be answered within 15 seconds, and 99% should be answered within 30 seconds. So this is quite tough KPIs really. And as I mentioned, the time to the first measure from answered 112 call should be 24 seconds at most. That's our goal. And the first measure could be listening in with dispatchers or forwarding the call to the police. All call takers, dispatchers must be certified at all time. We do a virtual test once a year, and we do perform regular monthly reviews. We are listening together with the call taker on 2 emergency medical calls and 1 fire rescue calls. So the call taker and the immediate supervisor performs this review together. And we do have a standard for the PSAP premises, how to be equipped and built so they are secure. We do have 1 PSAP which is situated underground, and that is in Stockholm. The rest of them are above ground, but there are strict rules how to build them and how to perform if you want to get in. We have 2 doors. You have to pass the first and then call and be let in by an operator who can see you. Answered 112 calls. Well, we do see the trend going up. It went down somewhat in 2021, and we are not sure why, but maybe it was some pandemic more in the 2020. And as you can see, we take action in almost a third of the calls, almost 2/3 of the calls, but still 1/3 of the calls are not real 112 calls. The largest part of them are, of course, pocket calls, silent calls, around 700,000 a year. In 2021, as I said, 67.3% were action taken, and you can see that I recognize these numbers from other, that emergency medical services are the largest part, and also the police. Fire rescue services are a smaller part of what we handle. Some words around training of call takers. We have our own education of call takers. It's done in 13 weeks. And we do have our own training center, the SOS school, with own premises and own Cordicom machines to train in. And Cordicom, the CAD system, has a built-in training model, so we can actually train in realistic environment without causing any problems with mistakenly alerting rescue resources. And we do classroom training at this SOS school, alternating with the coach at the home PSAP every other week. And quite a big part of the training is done as e-learning, and we have done this e-learning since 2002, so I think we have a good e-learning system for it now. This is breaking it down. You can see we have an introduction week, then we do level 1 at the SOS school, back at the PSAP, back at the school, PSAP school, and so on. So we have 5 levels before you do certification, and part of this is 4 weeks practicing together with a coach in your home PSAP, actually handling 112 calls. And the coach is ready to take over if there's something going wrong, or well, if the student needs help in some way. This is the 5 levels. I won't go into detail in them, but as you can see, there's quite a broad education in many areas. I mean, this is a very broad process that we handle, everything from broken wrist ankles to large fires or terrorist attacks or whatever. So we do have to train our call takers really thorough. And between, when you have finished level 1, you have to do a certification test, So you can see that this student really has got it. He knows what to do, or she knows what to do. And this is the case between every level. And as I said, after level 5, it's this big certification where you do see all moments that this student is ready to answer 112 calls. Some words on the features we do have. As I said, ongoing development. We will now upgrade to next generation 112, hopefully done in 2025. We have been doing advanced mobile location since 2019 in the autumn. Is working incredibly fine. This was a game changer when it comes to quickening up the process and getting a better location, of course, than the cell ID. We are registered in the transnational database. I don't understand why not every European country is that. What do you say, Christina? Hard to understand. We do transfer around at least 1,000 calls a year to other PSAPs in other countries. For some reason, you have the caller in Sweden are talking with a relative in another country, and the relative falls sick and faints. Then you have to, I mean, they call 112 and ends up in Sweden, and we do have to transfer this call to the relevant PSAP. Otherwise, there's nothing to do. We receive e-calls since 2017, manually and automatically triggered. And we do also have agreements with some of the third-party service PSAPs. We have registered defibrillators, AEDs, in a map, which we use when there's a heart failure, a heart stop, cardiac arrest. We can use this and direct the caller to the nearest AED. Works also incredibly well. We have drones with defibrillators. I hope you noticed we got an award for this the other day, and this is quite an invention that we are proud of. And we have SMS Lifesaver volunteers that can be alerted if there's a cardiac arrest in the near vicinity. Last picture, some words just around the non-emergency numbers, because these numbers maybe not as important as the 112 number, but really important to unburden the 112 number. We do have a number for healthcare device service. As I said, we do have a number for information from and to the public if there's a serious accident or crisis. It's actually handled by us at SOS Alarm also. And we do have a non-emergency number to the police, which is most important also. And we do receive still almost 100,000 calls a year that should have been calling on the 114 number instead. But it's getting better as time flies. And we do, of course, have numbers in the 116 series, the EU common series. And as I said, those non-emergency numbers are really important to unburden emergency number. I think that was it. Questions are welcome.
Yes, thank you, Björn. And do you have any questions from the audience?
Iracha, of course.
Thank you, Björn. I have a question about the joint cooperation you showed in one of these slides. So SOS Alarm doesn't have data sharing with each single agency, but you are on the way to do that. But do they share data between them, or do you know if they share data between them? Because during the intervention, in a multi-sector intervention, it may be relevant to share data between services, and does it have to go through SOS Alarm, or can they share data with between each other?
The simple answer is no and yes. No, they don't share data, and yes, it has to go through SOS Alarm. And I mean, we're in 2022. Why can't we do this, well, in a better way? But it's harder than it sounds, really, to share. And we started with Cordcom in the beginning of the 90s. Police has their system since, I think, the 90s, and the rest of them also. So it's more or less maybe old systems that can't communicate in a good way, I think. But we do have adapters between systems and so on. So we will. I'm not sure that everyone can share information with each other, but we are getting there slowly but securely. Thanks.
Hello, my name is Gilbert. Just a question about the turnover of the operator. So you told us that the training is very heavy, it takes a long time. And if the turnover is too much important, it will cost a lot and it will not be so much effective.
That's a good question. I didn't get into that, but we do have right now a large staff turnover. I think there are two major reasons for this, and one is maybe the pandemic. We have had large, not as much as expected, but there are a lot of sick leaves and also sick leaves for the children and so on, and has been. And that means that the other part is that the remaining call takers are very strained. There are lots of calls that you don't have the ability to take pauses, regular pauses, and I think many of the call takers has grown tired and just thinks I can't take this anymore, so I have to leave, and that in turn leads to the other call takers being more strained. So we have to recruit and train them, and that takes a lot of time. So it's not easy to cope with.
Do we have any other questions from the audience? It seems no, but actually I have one question. Did I understand correctly that you are using only e-learning to train call takers, or?
Not only.
Not only.
It's one part, and we do use it. We have lots of lessons in e-learning. So, but not only. Oh, no.
Okay, thank you. So I think that it's time to go on. And now Azhar Sulaiman from Telekom Malaysia. Floor is yours.
All right. Thank you. Good morning and bonjour, Marcel. All right. I'm Azhar. I'm from Malaysia. I work with Telekom Malaysia for almost 25 years. Right. So what I'm going to do is I'm going to present about the modernization of emergency services in Malaysia. So some of you that do not know where Malaysia is. So we are in Southeast Asia, right? To the south is Singapore, and to the north is Thailand, right? And to the further south is Australia, right? So very nearby to Indonesia, to Australia, as compared to travel from here to Europe. So we got to take about 18 hours flight all the way from Malaysia, Kuala Lumpur. All right. We have 13 states altogether, all right, with 3 federal territories, all right. And then the current population in Malaysia, as of April 17, 2022, is 33 million, all right. So most of them, 75.1%, is living in urban area. So each of those states, they have cities, right? So these people will be staying at the city, right? But there are not as many as staying in big city like Kuala Lumpur, Penang, Johor Bahru, Kuching, and Kota Kinabalu. All right. So 24.9% living in the rural area. So rural area, I consider that it is in the east of Malaysia, right? And also in east of Malaysia, if you're on the right side of it. All right. The coastline. So we have a very long coastline, which is 4,675, right? And with a beautiful beach, right? And then the area, we're talking about the land is about 33 million, right? And then the forest covering Malaysia is 55.3% of it, right? So the roads is 375,000 kilometers, right? So if you have read a lot of, the newspaper, for example, or from the website, we have quite a large number of road accidents, for example, right? So we are talking about 400,000 road accidents in 2020, I'm sorry I don't get the latest statistics. But definitely when COVID came back in 2020 and 2021, for example, the number of road accidents is not as much as what it is on a yearly basis, right? And then the number of fatality injuries is, we're talking about 12,000, right? So hospital and special medical institution in 2020 is 146, but as of now, it is already increased. So some background on emergency services that we currently have is back in 1957, right? So we have a lot of numbers, right? So police and hospital, for example, the people will be calling 999. And then for the fire department, they'll be calling 994. And then for the civil defense, they'll be calling 991. But in 1st October 2007, right, the government has decided that to introduce only one number, is only 999, all right? So it consolidates not only these 4 on the left side, right, but it is consists of 5 core public safety and emergency agencies, right? If you see on the right side, it is a police, fire and rescue, hospital, civil defense, and maritime, Coast Guard, right? So the aspiration is to have one number, so it's easier for the public to call, right, instead of remember so many numbers when it comes to emergency. So the current responders is, as I mentioned, there are 5, all right? Those people, I mean, the people when they're having a problems, for example, they can call police, and if they are at sea, for example, they can call maritime. So the evolution of emergency services in Malaysia, as I mentioned, back in 1957, all right, 3 numbers. And in 2008, right, so we introduced 999, phase 1, whereby the call takers will be filtering the call from the public before it reach the 4 agencies. So what are those response centers does? They will filter the crime call, they do the filtering for that, and they gather information and send to emergencies agencies. All right, and back in 2011 and 2012, all right, so we implement most all of the states in Malaysia, right, which is in phase 2. So at that time, all right, so the public can reach all the 5 agencies, including the maritime. And we launched our smartphone apps back in 2013 for the deaf, all right? And then we continue with that with phase 3, which is completes all those states back in 2014. And we also introduced Save Me 999 for the blind, all right? So we have a number of disabled, right, which they can call, right? And then also, we also introduced smartphone apps, which is not only for the police, but it is for all the agencies. But we name it as the Save Me 999 by the government. And this is especially when it comes to robbery, for example, you are not able to communicate direct to the call center when maybe the robbers can hear the communication, right? They can use the apps, right? And the important thing is before you use the apps, you have to register your name with the ID number, national ID number. So whatever things happen, for example, you just can click the Save Me 999, when we know where you are and we know who you are, right? Exactly using the GPS. So here we are now in 2022. So we are moving to NG, Next Generation 999. All right, the very important things I need to share your experience, our experience is, with the 12 years experience that we had with 5 agencies, for example, right? We gather all those information, we gather all the problems they are facing from the beginning. Usually the system itself doesn't really can meet whatever requirements, because the important thing is those people at the responders, for example, they are the one that really understand what they want actually, right? And second thing, it's not easy actually to merge with different protocols, all right, with one numbers, because each of these agencies, they have their own protocols. They have their own ways of doing things, right? So we managed to do that, right? So even though there was a lot of things, I mean, to make sure those things happen, right? So finally, it is a success story for all of us. Even we are moving advanced in Singapore and Thailand because of this, right? As compared to other countries, they have a lot of numbers, all right? So the coordination of this is very important because for the response center, for example, when we have 13 together event codes, right? Whenever we receive the call, the PSAP, the response center, right? They have to understand what is actually going on, whether it is on a road accident, whether it is, you're talking about flood or something like that. And remember that when it comes to road accident, sometimes we are not even require police or ambulance. We may require more than that, right? So the coordination by the PSAP or response center in Malaysia is very critical to ensure that we can save life. So the important thing is we are talking about command, we are talking about communication, we are talking about control. That's very important, right? And then we also certified for the protocol, for example, for fire department. And in 2023, we also will be certified with a medical protocol. So for NG999, we are following the trends, right? So make sure that the smartphone we can access through the smartphone. We also will be using the social media. We have a lot of data, for example, back since that we have been starting in 2007. So imagine the number of data that we have in our big data. We can do a lot of things from that, right? So we also have a drone, right? And EML also will be introduced, right? And we will be using the artificial intelligence, right? But all this will come in together with NG999. All right. Share with you the current emergency services in Malaysia. All right. Currently, as I mentioned to you, we only have two ways of communication. One is using the voice call, the normal voice call, from the fixed and also from the mobile. All right. They can also use the mobile application, say Me999, as I mentioned just now, right? And it will go to Response Center 999, where Response Center 999, they have together the fire protocol, right? So they will do all those filtering to make sure that it is the correct, we can send it to the correct dispatch center on the right side, all right? For example, so the second thing is whoever calls, whoever they are, right? We know who's the caller is, all right? We have integrated our system to all 5 mobile operators. So whenever they call from other different operators, they will reach us, comes together with the name, all right? Also, the number, all right? And the location. That's very important. So the first thing when they reach the response center or PSAP, we will greet them by the name, for example, right? Christina, may I help you? These are the things, all right? And then we know where you are, all right? Unless the current system with the limitation is if you are the roamers, for example, right? We are not able to recognize you, but we know the location where you are. Then we know all those the parameters that we have in the system, okay? And the system will go to agency full CAT. We are using the CAT, all right? And those information will be keyed into the CAT, every single line item, right? And it will be dispatched to whether it is a medical protocol for Ministry of Health or we send it to Fire and Rescue Department. Let's say, for example, when the accident happened, there is a bad injuries, for example, which is require the fire department to open up the car, right? So the CAT system will be copied to fire and rescue department. So the fire rescue department will come and to do the rescue, okay? This is the current one. So for the future, upcoming emergency services in Malaysia in G999, right? So will be introduced push notification. The traditional voice call will be there, right? And mobile application will be upgraded, right? And then also will be introduced sensor. Sensor meaning to say that we are talking about e-call, we are talking about those alarm from home, from the shopping mall complex, or whether at the park, if there is any emergencies, you just can go there and press the button and the police will come, right? So we'll go into the communication control point, right? And then before it reach response center NG999, and the data center will process all the data, right? And before they send it to the new agencies CAT, right? And also new agencies like CAT. So the difference is what we have now and the future in 2023, right? Whenever we dispatch, for example, right, and the agencies will know, the response center will know where is the current, for example, the fire asset or the ambulance will reach the destination. So imagine you are calling for Grab or Uber, for example, right? Or a pizza or something like that. You know when your food will reach the destination. That will be the same things that we will implement. So we don't want that the caller will be worried about when the ambulance or the fire department will reach them, because that is very important. If you're talking about Kuala Lumpur, during the peak hours, it's going to be very, very busy, right? And that system will help, all right? Will help the agencies, for example, to determine the best route to reach the destination, yeah? And at the same time, the responder apps also will help them to help them to show what is happening at the site, direct to the command center, for example, in a hospital or that, so that the doctors will be ready at the emergency department. Okay, for next gen 999, we have learned something from the current COVID, all right? Currently, we have 3 response center PSAP in Malaysia. We have in Kuala Lumpur, we have in Malacca. The other one is in Kuching, in Borneo, all right? So some of the staff was infected by the COVID, and we have to close the PSAP. So with that, we introduced the mobile PSAP, which is they can turn on the laptop from home, they can receive the call from home, or they can call it from anywhere, okay? Okay, this is some scenarios of the emergency call. It's from the public voice call and data, and then it goes to response center call takers. And then from the response center, the call takers will send the data to the command center, and then before it reach operation center and responders. And then currently, we are not able to call the caller, right? The caller, the emergency agency is only the one that can call the caller, right? So in the next NG999, we will be able to call the caller, right, and to ask them whether the agencies, the emergencies agency, already reached and help them, yeah. So for the call takers, these are the very important element that we are working on, which is on the standard quality assessment for handling emergency protocol. All right, this is always a year around of assessment that we are going to do, right? And then also standard quality assessment by evaluating call takers' performance. It's very important, all right, to understand and then to make sure they are at the good condition. And quality improvement programs is on a yearly basis that we will be doing it, not only with the PSAP, but also we do the same as well with the response center, with these emergency agencies. We have an award, we have the best call takers, for example, we have the best dispatch and all those things, right? And then the training and development is ongoing. So we have, the training is done, currently is on manual basis, whereby you have to go to the classroom, right? But when it comes to NG999 later on, we'll be introduced e-learning, all right? So this is, we learned it from COVID as well, right? So we can do, we have our studio whereby we can do the training from the studio, and then we open up whatever things, and then they can see it from the web, for example, right? So the training is very important. It's a long year-round training, right? It's not about talking about training to the response center or the PSAP, but the same training will go to all those agencies. Imagine that we are having 5 agencies currently. We have police, and police, they have their own training. For the fire department, they have their own training, and the rest is the same, right? And imagine the number of turnaround, right, for people, whether it is from police and so forth. It's quite rampant, whereby the training is always ongoing. All right, so here we are on NG999, all right? We estimated, currently we are on the solution implementation, right? The good thing is we understand and we know what we want actually based on our experience with the agencies, right? And the technology will comes later, all right? What we did back in 2007 was the technology came first, then only the requirement from the agencies, but now it's different. We understand what the fire department wants it, what the requirement from the police. We sit down, make sure that this is the real things that they want, right? Then only we determine the technology, all right? But thanks to EENA, because we are referring to EENA's website all the time, and then we are also referring to EENA's partners to see which is the best technology that we could furnish our needs, all right? The important things is what we did is we also implement procurement engineering, right? All of those technology providers, they are required to send us all those proposals to us, and then from there we evaluate whether they are really can do it. Because when we talk about technologies, for example, CAD, for example, right? I think CAD is a commodity whereby everybody can do CAD, for example, right? But actually whether that CAD can really meet the requirement of all the agencies is very important, right? And then definitely the customization has to be done, because we know the agencies themselves, because the culture in Malaysia may be different. It's different in Europe and America, for example, right? So we know how they work, because we cannot say that, I mean, like fire or ambulance services, pre-hospital care in Malaysia will be the same in Europe, or maybe the same in the US. It's different. So that's the thing that we really understand their requirement, make sure that by having a lot of workshops with them, I think based on my experience, we have done like more than 5 workshops together with them to really understand what they want, right? And then from there, then only we talk about infrastructure readiness, which is to us, we're talking about estimated timeline of 6 months. Remember that MERS 999 currently we are all connected, right? With 400 oversights. But when it comes to NG999, right, the requirement has increased from 400 to 839 sites throughout Malaysia. So there's a big thing, right? So when it comes to NG999, the current system will be phasing out, right? So what happened is we're going to change to the new one. everything, the new system, the new communication, the new CAT, the new network, new talking about, we are using the virtual private cloud. So it is not even a single things that have been using back in 2007, the current using here now, right, will be used back for NG999. It's going to be a new one, yeah? So imagine with that, it's going to be a very huge development, huge budget required, right? And but finally, the government has given their green light to proceed with this, because this is very important. We are talking about saving life, right? And then user training and technology transfer is very important as well. For those who are coming to Malaysia, for example, with their technology, remember this is very important. Technology transfer has to be there. So we want to understand more about that. And the office has to be in Kuala Lumpur as well. Because if you are somewhere in Europe or US, right, if anything happen, right, so we are like different time zone, 7 hours from here, and Europe, or maybe more than 12 hours or 18 hours with the US, right? So we are planning to ready with NG999 in August 2023, right? That is our commitment to the government. All right, talking about public warning system, all right, has already been there, for example, back in 2017, whereby Malaysia is a tropical country. We have rain and shine, rain and shine, rain and shine. There's no snow whatsoever, right? So whenever it is rain, right, flood will also be there. And then the recent flood recently, like 2-3 months ago, right, it's really affected the city of Kuala Lumpur and Selangor. So a lot of people affected. So even you have a good system, for example, you have a good notification system. If it is, for example, has reached a massive flood, the system that sometimes cannot help. So it's about how the people move and how fast they can leave their house to go to the rescue center. All right? So I think this is going to be my last slide. All right, I think that's all. If you have any question, please feel free to ask. Thank you.
Yeah. Thank you. And do you have any questions from the audience? Okay, actually I have one question. And you also.
Maybe they don't understand me.
Actually, I would like to know, there was on one slide that with the NG you will use artificial intelligence. Do you already know how and
Again? Yeah, again? The application?
Okay. Okay, yeah, thank you.
The question is?
Actually, the question is that there was written that with NG999 you will use artificial intelligence. And do you know already how you will use it, or?
All right. This is the plan is whatever things, the application that we have in the current 999 will be upgraded. And the future application, for example, we'll be using fire hydrant application. AED application will be introduced as well. And e-call will be also introduced in NG999. Because currently the system that we have back in 2007 is similar to what, if you remember our Nokia 3310 as compared to our new smartphone, right? It cannot be upgraded, it cannot do anything, there's no data of that. So with the new one, a lot of things that we need to do, right? And the access to 999 is, we are not limited to, as I mentioned just now, it's not only limited to voice, we also will open it up to voice call, video call. We also open it up to radio communication, right? And as I mentioned, it's on IoT. Also, we allow that to happen. Okay, in 2023.
Okay, thank you. And Björn?
Yeah, just a short question. You mentioned that you moved to mobile call taking, call takers sitting at home, as I understand it. What are your experiences with that?
Currently, we don't have mobile call taking. But based on our experience with COVID recently, right, it's very important because currently we have 3 response center or PSAP, right? If any of those 2 has to be closed, right, we only left with 1, right? And the number of calls we are talking about 1 million calls per month, all right? So in total is a 12 million call, right? So we need those PSAP or response centers, for example, is already been closed, so they can turn on anywhere from home, for example. Turn on the laptop, and then they can receive the call, right? And the important thing is to have the good internet connectivity. Am I answering the question?
Yeah, sure. Thanks.
Welcome.
So it seems that we don't have any more questions, but now you can enjoy your coffee break and you be back in plenary room in 10:40, and then you can hear about preventing forest fires. So thank you.